This policy can be found under vascular access titled Intravenous Therapy. First, confirm the order, making sure that the drug ordered is appropriate to be administered through a peripheral IV. You can see Appendix A for a list of vesicants and irritants. Assess the patient for age, diagnosis, developmental, cognitive level, the need for child life, and local anesthetics. Check for potential allergies regarding tapes and solutions. Also determine the need for extra holding help. Explain the procedure to the patient and appropriately to the family. Select the correct PIV site based on the patient's size, age, vein, and skin condition. Select appropriate size catheter. In this case, for smaller premature infants, you may use a 24 or a 26 gauge. For the larger or school-age child, you can use a 24 or 22 gauge. And for the adolescent or adult, you may use any size that's appropriate. Placing the peripheral IV. First, clean the work surface and perform hand hygiene. Prime the T connector with saline without touching the injection port and leave the syringe attached. Remove the protective covering over the tip. Loosen the lower lock, and be careful not to contaminate the tip by leaving it in the sterile package. For optimal results, have child life specialists present, make sure the patient is in a comfortable position, and have extra holding help available. Apply the tourniquet. Cleanse the insertion site with antiseptic and allow it to dry completely. Stabilize the vein by applying pressure and stretching the skin. Do not touch the intended insertion site after prepping. Penetrate the skin and vein wall at a 15 to 30 degree angle, which may vary according to the depth of the vein. Advance the catheter until blood return is noted in the catheter or flashback chamber. Lower the angle of the stylet and push the catheter forward slowly into the vein. Remove the stylet, making sure the safety mechanism is engaged. Apply pressure on the vein above the tip of the catheter, control bleeding, and connect the T connector to the hub. Flush the catheter and watch for any signs of infiltration and assess for pain. Leave the syringe attached. Apply the skin protectant, allow to dry, and then place the stat lock over the top of the catheter. Remove the adhesive backing. Flush the catheter again to make sure that it's not kinked. Place a folded 2x2 under the T connector to prevent tissue damage. Cover the entire area with your transparent dressing. Tape 1-inch paper tape. And make a small slit in the center and place it over the end of the T connector. And then take another piece of 1-inch tape and place it over the top. Never cover the insertion site with tape. It must be visible at all times. And make a loop with the T connector tubing. Add the padded arm board, making sure that the fingers are over the end of the board. You may use an additional device called the house to protect the end of the T-connector, placing it over the end and taping it with paper tape. Lastly, you want to label the PIV with your initials, the date, the time. Finally, apply the SurgiNet netting over the top of the peripheral IV and the board. This will help to secure the extra tubing. Remove gloves and perform hand hygiene.